We are born free, and we will die free. The time in between, though, that's complicated. In that time, governments, institutions, and our egos will limit our ability to find true freedom in this life. These are real stories of real people overcoming the odds, persevering in justice, and unlocking their potential. Welcome to Finding Freedom. Here's your host, John Odermatt.
Hey, welcome back to another episode of Finding Freedom right here on the Lions of Liberty Podcast Network. And I'm going to get to it quickly today, introduce my guest in just 1 minute. Just one thing to say. We did recently launch a Telegram channel. Facebook has gone totally crazy, and they're not letting us broadcast to groups or really do much of anything at all. So I will post that on our website on the show notes page. You can find it there. Our Telegram channel, as well as for our patrons, we have a Telegram group as well. So you can find both of those. And limited time today. I don't want to waste any of my guest time. I have an incredible guest. I'll bring him on the screen now. You know him, you love him. He's Dr. Peter McCullough. Really, no need for an introduction. I think my audience is very well aware of everything Dr. McCullough has done, especially over the past few years in regards to COVID-19. So Dr. McCullough, great to have you here.
John, great to be here. That's a killer opener with freedom and breaking the chains. Let's get after it.
That's what it's all about. And we'll get to that today. I do want to talk about towards the end of this show, how do we break the chains and really expand our medical freedom here in this country? So I think that's very key. And I think that's a big takeaway, and maybe a positive that can come out of this whole COVID experience. But before we get into that, I've had some questions. I've seen a bunch of your interviews, but I do have some questions that I've been curious about. And I don't know if I've seen them addressed specifically, but, obviously back in 2020, when you came onto the scene, prior to that point, at least from my perspective, you seem to be, pretty well accepted in the medical establishment, many thousands of published papers. I'm curious, at that time, when you did start to speak out and you got that opposition and you were called a conspiracy theorist, what was that time like for you personally, facing that?
Yeah, I was already very well known in medicine. I was the most published person in my field in the world in history. I testified at the FDA, European medicine agencies. I gave grand rounds at every major medical school in the United States and across Europe. I testified in a congressional oversight panel in 2007. So I was already well known, and the press started asking me on for my opinions. What shocked me is how the medical community did two things. They actually failed to treat sick patients and prevent hospitalizations and deaths. And then they pushed vaccines, which turned out not to be safe, and they didn't work. No one's a conspiracy theorist. We're rational theorists. Conspiracy theorists, that's actually a word out of communism and Nazi Germany. We're not conspiracy theorists, but we're rational theorists. We have theories about, evolving problems, and they're testable and they're discussable. And when people failed on this very important point of discussing and honoring and respecting different viewpoints, things started to collapse.
So back in that time when things really started going wild back in 2020 with COVID coming onto the scene, when did you first realize that the traditional medical establishment was treating COVID entirely the wrong way?
About March of 2020, when I realized the medical community was not going to have early treatment protocols. We heard nothing out of Harvard or Duke or Mayo Clinic. To this day, they claim they don't know how to treat outpatient COVID, using drugs in combination, creative use of other products to help get people through the illness. They never posted a Harvard protocol. When I told Tucker Carlson that in May of 2021, he dropped his jaw. He goes, "What?" I said, "Yeah, our marquee institutions are absolutely failing America." And if you look back in history now, it's a very important observation. in the time of a crisis, the answers never come from the system. They never come from the orthodoxy. Harvard's never saved us before, nor Duke, nor Northwestern, or the Mayo Clinic. They don't. The answers in the time of a crisis come from people in the field innovating. It was really independent doctors that innovated, published their findings, showed that they worked, and then advanced. And, we didn't rely on any single product, but we used drugs in combination. However, the government and governments all over the world malign specific products, initially hydroxychloroquine, then later on ivermectin. You probably heard the story. The FDA had to retract all their false claims in ivermectin. Recently, Chris Cuomo on CNN, who is shaming people for taking ivermectin back when, we were using it in the heat of the pandemic. Now he concedes he's wrong and he's taking it himself.
Yeah, he's taking it because he says that he's suffering from long COVID. He didn't really apologize for leading the charge, calling it horse dewormer, this very well tested and widely used drug for many years. Just unbelievable to see the pivots happening. Do you think that we'll ever get to a point where people like yourself, people like, Dr. Robert Malone will really be fully vindicated? And I don't know if people are going to apologize, but will the traditional medical establishment ever admit how wrong they got this?
Well, they better come around quickly. I should be giving grand rounds in every major medical school now on treatment, diagnosis, management of vaccine injury syndromes, which are horrific. Heart damage, blood clots, stroke, immunologic problems, emerging cancers. They better move quickly because the nation's going to get very sick. I testified in the U.S. Congress January 12th, 2024. I told them, listen, we got 5 to 15 years after these shots to worry about patients and worry about our family members. And we're seeing it. We're seeing cardiac arrests more than 3 years after the shots, blood clots, emerging problems. It's horrendous. So they have to get around quickly. Listen, I'm one of the most published people now in COVID-19. My papers are widely read all over the world. They know who I am. They need to pick up the phone and make the call because our medical students, our residents, and our attendings are falling woefully behind on the state of the art on how to treat vaccine injuries.
All right, let's dig into that a little bit with these vaccine injuries. You said 5 to 15 years. First, I want to talk about some of these injuries that we're experiencing now and what you think could happen in the next 5 to 15 years with these vaccine injured, and then I want to talk about how can these people start to detox. But first, these vaccine injuries. What are you seeing? Is this something that can play out? Someone can get a COVID shot this year and then suffer the consequences from it 10 years from now?
Yeah, it's certainly possible. The big one's cardiac arrest. Now, myocarditis or heart inflammation, when severe, people feel it and they go to the hospital. They have positive blood tests, EKGs, cardiac MRIs, but that's only half the time. The other half the time, they don't feel it. And the first manifestation is sudden death. I actually think probably the most common presentation is a cardiac arrest in somebody previously healthy. So when you see a cardiac arrest during sports, or between 3 a.m. and 6 a.m., those are 2 times where there's our surges of adrenaline. Think vaccine, cardiac arrest, myocarditis. The next person who drops, unless there's a terminal illness that they have, or another explanation like a suicide or drug overdose, it is the vaccine until proven otherwise. Paper by Holscher and colleagues, European Society of Cardiology, just nailed that down. So myocarditis, cardiac arrest, think vaccine. In that same category, the vaccines accelerate heart attacks, atherosclerotic cardiovascular disease, heart failure. They cause a condition called POTS, posterior orthostatic tachycardia syndrome. That's actually passing out without having a cardiac arrest. You probably saw those newsreels, John, of everybody passing out. That's called POTS. Yeah, it's POTS. And then in the neurologic category, the big ones are stroke, both ischemic and hemorrhagic, especially young people with strokes, teenagers, people in their 20s and 30s, think vaccine. Guillain-Barré syndrome, small fiber neuropathy, all these tremors, potentially, acceleration of cognitive deficits, motor disorders. It's all related to the vaccine. Third area is blood clots. Next person who pops up with a blood clot, think vaccine. The COVID vaccines cause unlimited production of the spike protein, the Wuhan spike protein that was designed in the Chinese biosecurity lab. It causes blood clots, biggest ones we've ever seen in medicine. The great concern is that someone takes the vaccine, that the vaccines don't work, and they get COVID, they get exposed again to the spike protein, and boom, end up with a blood clot, both arterial and venous, certainly can be fatal.
I'm glad you brought that up. So somebody getting a vaccine and getting COVID with the spike protein, what's the difference between the two? Between someone getting COVID, naturally, and somebody injecting it through the vaccine?
When someone gets COVID, the spike protein, which is spine on the surface of the virus, it actually locks into the human ACE2 receptor in a cell. The S2 segment is sacrificed, and the S1 segment goes in cells. So with the viral infection, you can get the S1 segment that gets into the human body. If you treat early, use nasal sprays and gargles, you can limit your spike exposure. When you take a vaccine, you get the genetic code for the full length spike protein and produced for unlimited durations and quantities of time. So the vaccine gives the body way more spike protein. Spike protein can be broken down by the human body. It stays in there until you do something about it. So that's very important. Now, fourth major area is immunologic problems. And so we have to take blood tests for that, the ANA, the ANCA, anti-CCP, and rheumatoid factor. And then we can treat it. Actually, the autoimmune problems are very treatable with hydroxychloroquine. A fifth emerging area is cancer. I think the jury's still out on that, but great concerns. The vaccines could cause cancer.
So just to pause on cancer for a minute, I know that there's not as much certainty around that maybe, but is there a difference between that we can start to see between the cancers that we know well and this COVID vaccine-induced cancer?
The CDC should immediately merge the CDC vaccine data with the cancer registry data. That's the first way. Our government knows the answer about these rapidly emerging aggressive cancers. They're called turbo cancers. Now, in general, it takes about 5 years from the time a cancer cells start to form to actually be able to detect it in the body. The thought is the vaccines could be accelerating this. I'm greatly concerned. A paper by Anguis and Bustos, University of Oregon, has posited that it's a multi-hit hypothesis. The vaccines do multiple different things to the body to promote cancer.
Okay. Before we move on to detoxing from the vaccine, just to go back to, people contracting COVID, and something I've heard you say in a recent interview, and I think I heard this way back in 2020 and 2021 as a way, or a surprising way, that people were avoiding or getting very low COVID symptoms. And that was from smokers and nicotine helping with COVID. Is that accurate? Is that true?
It's accurate. It's exactly the opposite of what we thought. We thought smokers would be ravaged by COVID. In fact, they weren't. Almost every analysis showed smokers had an easier time with COVID. Now we learned that the nicotine receptor plays an important interaction with the spike protein. Nicotine actually blocks the spike protein. And so now we routinely use nicotine patches to treat long COVID and vaccine injury syndromes. So that's come into community standard of care, and it works.
For long COVID, I don't doubt that long COVID is real. There was a time when I did doubt it was real or not, but how much variance is there in long COVID symptoms? Is there a way to pinpoint that someone actually has long COVID?
Paper by Dexner and colleagues from Germany, 48,000 Germans. Long COVID is largely in people who took the vaccine because the body's already preloaded with spike protein. Then they get COVID and they get even sicker. Someone who hasn't taken the vaccine gets Omicron. Very rare they would ever get long COVID.
Okay.
But it can exist. I mean, I didn't take the vaccine. I've had 3 episodes of COVID. My ears are ringing. That's a manifestation of long COVID. And so, we use detoxification protocols for that. But I really worry about the vaccinated. Oh, my Lord. We're talking about people, they can't run. They can't go to work. They have post-exertional malaise. When we do muscle biopsies of the calf, the capillaries have micro blood clots. Chris Cuomo recently said he has micro blood clots. Someone demonstrated that to him. I mean, this is terrible. Taking the vaccine, having the vaccine fail, and then getting COVID and getting severe long COVID is really messed up America.
Yeah. And AstraZeneca just announced they're going to be pulling their vaccine. Now they said it's because they're not making money on it, which might be true to a certain extent. But also, didn't they also recently have to recognize that one of the effects of their vaccine is a potential for blood clots, right?
Sure. In British courts, they were faced by vaccine victims, and in a court case, they admitted that the product causes blood clots. What a disaster for a vaccine to cause blood clots! And in open court, and this was enough for actually the company to just pull the vaccine off the market altogether. Now, the company claimed there wasn't commercial demand, but I know that's a false statement, because the vaccines are all pre-purchased with government contracts. You can't buy a vaccine on the market. It's all pre-purchased. So it's not due to market demand. It's due to the fact that they're finally been nailed on the AstraZeneca vaccine. Not safe. Good riddance. It's off the market.
So getting into predictions, who knows? There's always some risk in predicting the future. But do you think the same thing will happen with Pfizer and Moderna?
It's inevitable. Pfizer, Moderna are just as dangerous as AstraZeneca. Janssen, which is nearly identical to AstraZeneca, it's already off the market in the U.S. They just pulled it off the market. Janssen and AstraZeneca are made by a biodefense contractor, Emergent Biosolutions, outside Baltimore. Why are biodefense contractors making human vaccines?
That's crazy. Wow. Well, it should be crazy, but I hear that now and it's like, oh, okay. It doesn't surprise me that much. Crazy times. So let's talk about a really important topic. So a lot of people have been vaccinated, right? Even people who were skeptical of it, they kind of allowed themselves to get in a situation to keep a job, or maybe a family member, kind of pressured them into getting vaccinated. Maybe they only got one, maybe they got two, but still they got vaccinated, and maybe they're dealing with some effects from it. Maybe not. Maybe it's just sitting there beneath the surface. What can people do to detoxify, to save themselves from this potential, next 10 years of dealing with an episode?
I've led the world on that area of research. It's called McCullough protocol, base spike protein detoxification. It's a combination use of nattokinase, bromelain, and curcumin. And there are nice combination products now all over the internet. So I can tell you, I advise the wellness company as chief scientific officer. They have the ultimate spike detox, but there are many others on Amazon. You can tell it works. It's all over, being used all over the world. Nattokinase and bromelain physically help the body clear and break down the spike protein from the vaccine and from long COVID. And then curcumin actually reduces inflammation. It's nice that they're natural. You don't need prescriptions. It tends to be a blood thinning regimen, so we have to watch for bleeding or bruising. But we use these drugs in combination. Starting doses are nattokinase 2,000 units twice a day, bromelain 500 milligrams a day, curcumin 500 milligrams twice a day, all on an empty stomach. And then we actually accelerate the doses from there.
And how long do people typically have to take this protocol to recognize effects from it?
People start to feel better after about 3 months, 6 or 9, but most people have to go to 12 months or more.
And can the level of spike protein in someone's system be measured? Can you see a reduction? Is that possible?
There are assays done in research where it's directly measured. Right now, we're using an antibody to the spike protein as a proxy for how much spike protein is still there. We use the LabCorp extended range. But I would imagine, over the course of the next few months, we'll have an antigen assay available, and it'll probably be the most widely used test in America. Everybody wants to get this spike protein out of the body.
Oh yeah, the market demand for that is going to be extraordinary for sure. So I think that's a good transition into breaking free from this medical tyranny. I know that one way that I think you're advocating for it is through your work with the wellness company there in your in the role you have with them. As you've kind of experienced these last 4 or 5 years in the United States, do you think we're at a point that we can break free from the shackles of the old medical system that we had into something more, consumer-led?
Yeah, for sure. Wellness company leading the way, nationwide resource, twc.health. They have the nutraceuticals and supplements. They take an approach of, using non-prescription various forms of, things you can do before you move on to prescription drugs. Wellness Company has telemedicine doctors certainly capable and willing to prescribe drugs, using a network of community pharmacies to fill them, medical education materials, and now critically emergency kits. This is very important. People can actually pre-purchase the sets of drugs they would need to handle problems. There's a broad aqua green general emergency kit for home, covers bronchitis and bladder infections and fungal infections, skin infections. There's a contagion kit recently expanded to cover bird flu. That's kind of your go-to COVID acute illness kit. The lime green travel kit covers travels, diarrhea. They cover everything you need to put it in your suitcase. And then the last one is the camping kit, which is the red kind of trauma bug bite kit. They're stylized and they're really, really helpful. People are relying on them. Wellness Company working on a way to refill what you use. Get a membership at the Wellness Company, twc.health, and join us. I think it'd be great.
And I just want to restate that this is all prescription based. This isn't something, right, that you're buying on Amazon and, you're getting a prescription for this and it tells you, what you would take in the event of needing to, correct?
Yeah, there's a treatment guide. Most people can figure this out. You're out in the woods, you get a tick bite, it starts to make the classic circular target lesion. It's Lyme disease. You don't want to wait 2 weeks to have that Lyme organism get into your heart and brain. Start the medicine right away. We cover this. We even cover anthrax. And there's a guidebook, shows you what to do, telemedicine consult to help out. People are using it. The contagion kit, again, we're ready to cover bird flu. There's going to be a huge push to vaccinate animals and humans with bird flu. I think it's going to be a giant mistake. Bird flu, we can get with it with this approach. So go to twc.health. Check out everything that we have. We have, I think, the best detoxification program for the spike protein, long COVID vaccine injury syndromes, and these emergency kits. If they declare a worldwide bird flu crisis, and by the way, the FDA commissioner was in the Senate 2 days ago saying that the virus is mutating, it's going to go into humans. I mean, they couldn't be more telegraphed. Everybody should be ready.
Oh man, scary stuff. History doesn't repeat, but it rhymes,
right,
as they say. So I'm curious, from your perspective, you've been in this field for a long time. You've been in medicine for a long time. Do you see some of your colleagues? Do you see young people that are getting into the field? Are they understanding really what happened during COVID and how wrong things were, or are they digging their heels in?
I had on my show Claudia Chauffin from York University in Toronto. She's a sociologist. She said the young people, they're indoctrinated. They're indoctrinated. The government PSYOP worked. So that's the reason why no young people protested the vaccines. They took them. They actually think the vaccines are good for you, that you protect others, even though they don't. So the freedom movement's largely, middle-aged or older people. It's interesting. And none of the young people are waking up to figure, wow, I got myocarditis or a blood clot or a problem. It is absolutely shocking.
It's wild. Yeah. And it's right. I mean, you see it everywhere, young people having heart attacks, having this stuff isn't normal. Like maybe young people don't realize that because they are young and they don't have the years of experience to notice. But it's wild times. One thing that I did want to ask you about, because I've heard sort of conflicting views on this around spike protein shedding from people who have been vaccinated. So is this a real thing? And is it a real thing in that people shed for long periods of time, months at a time, or is it constrained to around the time that they get vaccinated?
Well, there's a paper by Brogna and colleagues from Germany. The spike protein from the vaccine is in the blood for 6 months. They showed that for sure. It could be longer. So if it's in blood, it's in sweat, it's in milk, it's in urogenital secretions. So it's there. The question is, how meaningful is it? I've interviewed Helene Benoun from INSERM in France, probably the world's expert on shedding. We think probably the clearest example is a woman who's menstruating. having normal menstrual cycles gets disturbed by being around somebody freshly vaccinated, and the woman's periods change. That there's enough reports of that. That's pretty solid. The transmission of messenger RNA through breast milk, that's been shown by Hannah in 2 papers. That's real. Vaccinated mother transmitting the messenger RNA to the baby through the placenta, that's been shown. But people are worried about hugging and kissing and other contact. There just hasn't been any confirmation of shedding with those. I tell people, listen, you've taken a shot, probably wait 6 months for close contact. And fortunately, virtually no one's taking these shots anymore.
Yeah, thankful for that. The people do seem to be backing off of it. There are still people getting their boosters. I don't really understand it at all. But unfortunately, Dr. McCullough, we are almost out of time here. But I just wanted to give you, some time here to plug anything else that you'd like to point people towards, or to double down on anything that you've said here today.
Well, everything I cite is on Courageous Discourse Substack. 90% plus of the content is free. So sign up for Courageous Discourse Substack. Get the graphical abstracts every day. My podcast, America Out Loud Talk Radio, McCullough Report, every Saturday and Sunday on America Out Loud, 2 p.m. Eastern, and then on the podcast circuit the following week. Have all kinds of top guests on. And my book, CourageToFaceCovid.com, 5-star bestseller, still kind of the best in class in the COVID genre. And then follow me on social media. They're still trying to censor me. I got the Top Doctor account on Twitter. I've got clearly a big social media footprint. And people follow me because I am sticking to strictly the published scientific literature. And I'm using my best clinical judgment throughout the pandemic and now for bird flu, everything coming forward. And you know what, John? I haven't been wrong. And people know that. And that's the reason why they follow me.
That's important. And on that note, I just wanted to thank you for, what you've done during this time, speaking out, people like yourself and Dr. Malone and others as well. I just can't imagine if we didn't have people like yourself who were not afraid to speak truth to power. I don't know where we would be right now. So thank you for doing that, Dr. McCullough.
Well, thank you. And thank you to, for really being a pillar for independent media. Missouri versus Biden is coming up, and, Biden may prevail. It may be game on for censorship in social media, mainstream media, but it's also game on for independent media, and that's you. Thank you so much for having me on Lions for Liberty. Thank you.
All right. Thank you. Have a good night. All right, that was my interview with Dr. Peter McCullough. Hopefully you enjoyed it. I just wanted to say again, if you guys like what we're doing here, if you like this show, please subscribe to the Lions of Liberty Network to get my show and Brian's show, Mean Age Daydream, as well as our Friday show, Meme Wars. If you want to just get my show in your feed, or if you just want to support me as well in the solo feed, you can subscribe to the Finding Freedom podcast. Appreciate it. Appreciate all of the supporters out there. If you are a Pride member already, or if you'd like to be, I just wanted to say that at our $10 and up levels in the Pride, we have started a Telegram group. We're taking things off of Facebook, and Brian and I are, wanting to really build a community where we can talk and share ideas and really try to elevate this thing more so. We used to have a lot more of a community and discussions on in our Facebook groups, but Facebook is terrible. So we're moving to Telegram with the group and the channel. You can find links to both on the show notes page. I will be back next week with another awesome interview. In the meantime, guys, always remember to keep your head up and those fires of liberty burning.